This Indian city has an army of volunteers fighting the spread of COVID-19. We spoke with some of them about their journey during the pandemic.
24/7 I'm working. I only sleep for 3 to 4 hours.
Bangalore has been one of the worst hit cities by the pandemic in India. The city, known as India's Silicon Valley for its rich startup and IT hub, has recorded hundreds of thousands of COVID-19 cases.
People are taking it very casually. They are roaming out without masks.
This is Ruksa Naz. Before the pandemic, she was working at an IT company, but since March, she has volunteered as a deputy district warden at the Karnataka Civil Defence Force. Ruksa spends her day mobilizing people to get tested. She also helps transport patients and monitors people's commitment to wearing face masks and social distancing.
The biggest challenge which I face is people are getting scared. They are fearing. They are scared like corona. What corona? Even the doctors go from PHC to get the test done. People think that they are the monsters. They are the devils of corona.
Ruksa works the whole week and only gets a couple of hours to rest.
I'm just doing a voluntary work without expecting anything. I'm doing it. My family support is tremendous, I could say, because 24/7 I'm working. I only sleep for 3 to 4 hours.
The main challenge she faces is convincing people how important it is to get tested.
We have faced a lot of issues when we go and knock out the people to come forward to take up a test. People will never come. They say, no, we are fit and fine. Why corona test?
India is conducting over 1 million COVID-19 tests per day, but in the world's second most populous country, the challenges remain huge. The simplest task, like finding a hospital bed in the middle of a pandemic, can be incredibly difficult. In response to these difficulties, Amin Mudassar has developed a platform that assists patients and their loved ones in getting information about health facilities available to them.
I am a social entrepreneur, a COVID warrior, and the co-founder of COVIDHelplineBangalore.com.
Amin was infected with COVID-19 in July and decided that he wanted to help people get necessary information about COVID-19 treatment and testing.
The government websites were not so easily accessed by people. So information was so scattered, and putting that into one place was the first reason why me and my friends, we all made this website.
Over 80% of India's population have no health insurance, and the cost of COVID-19 treatment in private hospitals is out of reach for the majority of the country. And amid huge demand on public hospitals, having online applications that provide timely information on bed availability, free oxygen, free testing, and even available ambulances can be life-saving. Amin's COVID helpline website has become a reference for COVID-19 information in Bangalore, not just for the people, but also for many government departments as well.
I think Bangalore has actually taken this pandemic as an opportunity to come together and work together.
In grief, there is also unity. Tanveer Ahmed is a social activist working with Mercy Angels, a group dedicated to burials of COVID-19 patients. He uses his scooter to travel between cemeteries and help with burial efforts. We caught up with Tanveer at this Christian cemetery in the suburbs of Bangalore.
During the lockdown, this was another opportunity where we had to stand out, help humankind, and I hope God Almighty accepts our work.
The stigma and the chaos surrounding the burial of COVID-19 victims during the early days of the pandemic motivated Tanveer to lend a hand to the families of victims.
Our motive was that a person would have lived his life for as long, and his final journey should be with respect and dignity, and with that intention we ventured in. We were able to pick up so many bodies. We were the initial people to pick up bodies in the city of Bangalore, and we've done close to more than 800 last rites.
With millions of active infections, the role of doctors has also evolved to include logistics and coordination. From this COVID-19 operation room, Dr. Bhaskar Rajkumar, a zonal coordinator in East Bangalore, is working with a team in coordinating various tasks, including organizing ambulance movement and uploading data on bed availability in private and public hospitals.
So this platform is directly linked to the platform which is an interface with the hospitals. So that solves the problem of a patient running door to door, hospital to hospital, identifying where a bed is available.
The scale of the coronavirus health emergency in India is unlike anything the country has endured in recent years, and has seen people come together to do what they can to fight the disease.
we needed the technology, we needed a lot of manpower, we needed volunteers, we needed the public to come in front. All of these worked as a single machine. So unlike individually only the doctors handling the disease, this time we needed everybody to work in coordination.